When creating a demand to increase endurance of the trunk flexors and rotators, it's important to know the patient's current level of function. Our patient today isn't a real patient, but we'll show you progression from easier to more difficult to meet your patient's needs. So we have Scott on the mat table here, feet flat on the floor, wedged up underneath a chair and a blue wedge. And what we're going to have Scott do here to work on trunk flexor endurance is to sit himself up to an erect position, have him hold it there for as long as he can until he fatigues, and then as he fatigues, he can gently go back down into the wedge. Nice, safe position. All right, so we'll have Scott do it now. Go ahead, Scott. All right. And then as he fatigues, he might go back down here. Some cues you may use would be to go ahead, give a nice straight back, exhale, and then bring yourself up, back away from the mat, and then hold it there. Keep on holding as long as you can. Go down if you go ahead, hold up. All right, relax. And this will be an easier part of the progression. To progress this, to make it more difficult for the patient, we could remove the wedge, put two wedges, just slightly lower them down until we eventually have them flat on the table. This position is going to be more difficult for Scott here. It's going to work against gravity fully. And you can also change the position of their arms to make it more or less difficult even in this position. So we'll start out in the easiest. We'll have Scott put his hands by his side. We're going to have him, Scott, lift yourself away from the table until you feel your shoulder blades come up. All right, very good. Have to do another one of those. He's clearing his shoulder blades, wonderful. And now to make it a little bit more difficult, take his hands, put it across his chest. Now have him do the same thing there, same cues. Come up till your shoulder blades are off the table. Hold for as long as you can. Again. All right. Now, the most difficult position would be to put your hands over your head. So Scott can do that. You can put them behind your head. Don't yank on your head, whatever you do. So here, we'll have him come up until. Very good. Now, for trunk rotators, we can do a very similar exercise, but alternating. I'll have Scott take his right hand to his left knee, and then his left hand to his right knee. So Scott, I'll have you do that now. Got some good trunk rotation there, and still getting that shoulder blade off the table. Good activation. How's it feel, Scott?
Feels good.
Feels good.
I'm fatigued.
Now, for endurance, we go until fatigue.